ABC for Health and Health Watch Wisconsin have been working to inform families, providers, advocates, and even policymakers on the issue of birth cost recovery for quite a while now. This is a policy that we've named the birth tax, and something that we're going to explain a little bit more in just a moment. I'm Robin Moy with ABC for Health, and I'm here with Bryn McBride of ABC for Health and Health Watch Wisconsin.
Thanks, Robin.
Yeah, thanks, Bryn. Today we're going to give a summary of the birth cost recovery or birth tax policy. Then we're going to introduce our managing attorney, Rich Lavigne, who's going to help us understand more about the legal implications of this policy. We're then going to finish off with a few family stories and strategies for advocates as we continue to navigate this policy that we argue is quite damaging and inequitable.
Right. And Robin, let's get started with kind of just an overview of what this birth tax policy is.
Yep, so this is a Medicaid feature, and it permits states to recoup expenses of births and deliveries that were paid for by Medicaid. It's a collection action performed by the county child support offices, but we need to be clear that birth cost recovery is not the same thing as child support, something we really stress. The state is actually collecting money from fathers to pay back the cost of a Medicaid-funded birth, and it's almost like a tax, which is why we call it the birth tax. And it's something that's done by counties at their own discretion and is not required by counties.
Right. And Wisconsin actually is one of the few states that still does this policy.
Yep, so Wisconsin is one of only a handful of states that even still collects birth costs, and as we know, it appears to be one of the most aggressive in its collection actions. Other states have concluded that these collections are not in the best interest of the family or the baby.
Right. And it's not everyone that's enrolled in Medicaid or Badger Care Plus that might be subject to this collection action.
Yeah, no, so if you're on Medicaid, it doesn't automatically mean you're going to be subject to birth cost recovery, but it's specifically and most commonly unmarried couples.
Sure.
So sometimes every now and then you'll see cases where the father is considered an absent father even if the couple's married, but most of what we see is an unmarried couple.
Sure.
And the cost of the birth was also covered by Medicaid or Badger Care
Right,
Plus.
so this is a collection action against the father, most commonly in that instance when the couple is not married.
Yep, correct.
Yep. And women are typically learning about this practice when they are asked to identify the baby's father.
Yeah, so on the Badger Care Plus application, there's going to be a part where the woman is asked to identify the father's name. This is a way for the state to establish paternity and then pursue collections to that person. But in fact, if a woman does not provide the name of the father for whatever reason, she could be deemed as being non-cooperative, which we've seen that resulting in sanctions against the woman, things like losing her Badger Care Plus coverage soon after the baby was born.
So not disclosing paternity could actually be a sanction. Tell me a little bit more about sanctions.
Yeah, so if a woman fails to cooperate with the disclosure of paternity, her Badger Care Plus coverage could be cut 60 days postpartum. But it's also important to note that there are some exceptions to this policy.
Right, called good cause exemptions to the policy.
Yep, so the birth cost recovery policy, built into that are these good cause exemptions. So if for whatever reason the woman does not or is unable or afraid to disclose paternity of the baby's father, she can apply for a good cause exemption. But as we know, these are things that most people don't know about. The process is already pretty complicated, so it's not something that folks necessarily know is an option for them.
Sure. Yeah, you have to know it exists to request it, and then even then there's a process. And we're going to be sharing some additional resources for folks on what this process of claiming a good cause exemption looks like to maybe make that a little bit easier.
Yeah.
Let's talk about that instance where there is a couple, they are not married, but they are living together, both raising the child. It's called an intact family. But the mother is still required to identify paternity in that instance.
Yeah, this is something that's really important to bring up because we do see it a lot. Generally, counties are supposed to use their own discretion when collecting birth costs, as it is a discretionary policy. But the situation needs to be clear when working with these intact families with how to go about collecting the birth costs.
Sure.
In 2018, we saw an administrative rule change that deemed it inappropriate to collect birth costs from an intact family.
So yeah, there was a proactive step that says if this is a family living together, the presumption is you do not collect birth costs. And the idea behind the rule change was...
So the idea is that, like we said, this is not child support. So if you're taking additional money out of the family, that's money that could otherwise be going to support the child. But when you're collecting it, it's taking money out of the household for an intact family.
Yeah, it's going the opposite direction of child support. It's not money going to support the child. It's money coming out of this intact household. And this rule change made that a little bit more stark.
Yeah.
There was actually an effort that was a little bit more statewide to make a change. Tell us about that.
So in 2019, we saw a movement from the governor's office to eliminate birth cost recovery from the state's budget. Unfortunately, that was not passed through the legislature. But some counties were then able to take matters into their own hands.
Right, as close as Dane County, which eliminated the practice, and we're going to talk to Rich about that in a second. But some counties said, it is discretionary, and we have enough incentive now to just not do this. They called it inequitable,
Yep.
and we've actually heard that language from other states as well.
Yep. So there, like you said, we're going to talk to our managing attorney, Rich Lavigne, who's going to tell us a little bit more about other states who have gotten rid of this policy and sort of what their argument was for that. But we know as recent as this year in Dane County, there was a move to eliminate birth cost recovery from the books, and that took effect January 1st of 2020.
Right, and it was a move, we would say, in the right direction, and some that other counties have started to look at as well. But again, when we think about the type of family this policy is impacting, it's typically going to be a lower income family.
Yeah, so as we know, we talked a little bit about the application for Medicaid. If a woman is applying for Medicaid or Medicare Plus, in order to get those sort of coverages, she needs to meet different low income eligibility criteria. So that already means that we're going to be impacting low income families just by that definition.
Sure.
But then we also see a lot of cases of families that are culturally married but not technically married by the state of Wisconsin standards. So then we're inequitably affecting people based on their cultural background and how their marriage and their culture goes.
And we've seen a couple families of the Hmong tradition, a traditional marriage from North Africa, where there was a cultural or traditional marriage, move to the United States, be told you're not legally married, this attaches to you in a collection action.
Yeah, definitely. We do see that. And we also see people that just proactively choose not to get married. And so they're living together, raising a family together, but marriage is not something that they choose to do. And then they're impacted by birth cost recovery.
Right. I mean, we've this archaic notion of the right order of which life events happen, first marriage, then child. And we've seen some young couples that said, we want to start our family first before we get married. And this still, even though that was a choice, this still attaches.
Yeah, definitely. And so you can kind of see how all these different things and things that you need to think about and these actions that are taken against the father can create all sorts of negative impacts in the household. Things that we know occur are parental discord, just creating tension between parents, lack of paternal support, and even toxic stress, which is seen to have negative health impacts.
Oh, yeah.
It just kind of piles on to things that are already stressful. Raising a new child is a stressful life event. Yeah. And so we're just adding on to that in ways that a lot of times we think is unnecessary.
Right. I mean, you think of one of the first things that a new couple, upon learning of the pregnancy, will get is a collection action from the state. And the stress that comes with that, the arguments that can happen within that household, impacting the pregnant woman, potentially impacting the health of the baby. It's not a good time to be stressing a pregnant woman. Like you said, we know what toxic stress looks like for a pregnant woman for a number of factors. And just adding one more thing to that, it's not in the best interest of the child, the mother, our community, the health of our community. And you're right, it's a piling on. We're going to pause here so we can introduce Rich Lavigne, our managing attorney. We mentioned a couple times he's going to be giving us a little bit more context to some of these equity arguments, as well as some legal context. We mentioned a couple other states that got rid of this policy. He's going to give us a snapshot of that. And then a couple more impacts of this policy. Thanks, Robin.
Thank you, Bryn.
And I'm joined now by Rich Lavigne, managing attorney for ABC for Health. And Rich, you've been tracking the birth cost recovery policy, the birth tax, for a while, participated in some working groups, as well as talking with families directly. And there are some legal implications and perspectives that folks should know about. But why don't you start by telling us who is subject to these collection actions?
Sure. The policy itself allows for some circumstances where a married father might be subject to a birth cost judgment. But in my experience, I've never really seen one, and I suspect they're few and far between. It would have to be a scenario where, for example, a married father is absent from the household. So primarily, we're talking about unmarried fathers who are going to be affected by this policy. Historically, that has applied to unmarried fathers even when they're actually living in the household with the mother and child and contributing to the support of the household. But that changed, or at least should have changed, effective in July of 2018 with a new administrative rule that says that it's inappropriate now to pursue birth cost judgments against fathers who are living in the household and part of an intact family. And it should also be worth noting that the child support agencies are really at liberty in any case to decide that they may want to waive pursuing birth cost judgments, especially if it's a situation in which pursuing the judgment would interfere with the father's ability to pay traditional child support.
So you said, in theory, this new administrative rule effective July 1st, 2018 should mean intact families aren't there. There isn't a collection action per se, but it is possible that maybe a hearing officer might not be aware of the regulation, or how would that play out?
Oh, I would certainly expect that to be possible. As we know, the awareness of the policy in general has been pretty limited, even among judges. So I think it's certainly going to be a case where fathers who are appearing in court and facing a birth cost judgment are going to need to be aware themselves somehow and raise the issue in court.
So there might be now, though, a kind of a changing of the tide where Dane County has a new a policy to not pursue birth costs. It was in Joe Parisi, County Executive's budget, to eliminate the collections for Dane County as of January 1st, 2020. Milwaukee County's been talking about it, at least among committees of the county board. Why potentially this change of thought, mostly for Dane County, but maybe for Milwaukee County too?
I think there are two possible reasons for that. One of those, hopefully, is a growing awareness of the inequities of the policy, in particular, its potential to contribute to adverse maternal and child health outcomes. As we know from our experience, from people we've talked to, from public health workers and social workers, there are at least some cases in which the prospect of a birth cost judgment causes a mother who would be eligible for Badger care to forego enrollment out of concerns for how it'll affect the relationship between the father and the family. And there is, some evidence to indicate that that concern is legitimate. We've seen some research out of the Wisconsin Institute for Research on Poverty that tends to show that fathers who have been subjected to a birth cost judgment tend to have lower participation rates in the workforce and lower voluntary contributions to their traditional child support obligations. So the outcome of that for these women, unfortunately, may mean that they have reduced access to prenatal care. And that limited access, plus one would think the stress of facing pregnancy and delivery with no health insurance may contribute to poor maternal and child health outcomes. Certainly, there are many factors that can contribute to those types of outcomes, but this is one that we can readily address and easily eliminate.
It's just one more thing, and it's pregnancy can be a stressful time anyway. We know that the impact of toxic stress on poor birth outcomes can be dire, and we're looking at this piling on. If you have one more collection action at a stressful time, that certainly, in theory, you think could have an impact.
Absolutely, and by and large, I think we're talking about mothers who are dealing with a host of social determinants of health, so this would be just adding fuel to the fire.
And there could be a disparate impact, treating different races, different classes, different ethnicities potentially differently just by looking at the numbers of who's enrolled in Medicaid.
Certainly, and the numbers, there hasn't been any great deal of study in that regard, but when we look just at the numbers of Medicaid births, we can certainly infer that this may have a disparate racial impact. For example, in Milwaukee County, we know that among white mothers, about 25% of all births are paid for by Medicaid. When we look at women from minority populations, now we're looking at more like about 3/4 of all births being covered by Medicaid. And of those, about 3/4 are to unmarried women. So that's a lot of potential birth cost actions disparately affecting minority populations.
So you said there were a couple reasons why Dane County and potentially Milwaukee County might want to get rid of this policy. The first was the inequities of it, but there could be a financial reason.
That's true. There's been a change in the funding policy for birth cost recoveries recently. Historically, Wisconsin and also the state of Michigan had been receiving federal matching funds from the Federal Office of Child Support Enforcement related to the amounts that they collected and paid out to counties from birth cost recovery actions. Just this past summer, the federal government said you can't do that anymore. And what it meant in the past was that for every dollar that counties were paid out for birth cost recovery for the incentives, the state would get very close to $2 in additional federal matching funds. Mm-hmm. With that no longer an option, the financial incentive to pursue birth cost judgments has reduced significantly.
Yeah, with fewer dollars coming in and the inequities piled on top of that, starts tipping the scales against going after these lower income families and these collection actions.
It should.
And Wisconsin, like we had addressed at the top of our presentation when I was talking with Robin, a number of states, most states have eliminated the practice of birth cost recovery. Only a handful remain. Why is it that most states are just not pursuing birth cost recovery actions?
Well, the fact is, most states never took it up in the first place. This whole policy originates back to a law that came out of the late 1970s when child support nationally was really more of a welfare recovery program for states. It was intended to reimburse states for the costs that were ostensibly being paid to public benefit programs for mothers and children who lacked support from their fathers. At that time, state Medicaid programs were encouraged to work with child support agencies to try to identify cases where fathers had access to health insurance that they could afford through a job, or had health insurance at the time that their child incurred medical expenses, and to then try to recover reimbursement from the insurance policy rather than pay it out of Medicaid dollars. Later on, in the mid-'80s, federal law began to require child support agencies to actually seek medical support orders as part of their child support orders. The problem was the federal government didn't really define what medical support meant. At the time, the Federal Office of Child Support Enforcement interpreted the rule to mean that when a father had reasonably affordable access to health insurance, he should be required to pay for that to cover the child. But other states, of course, took a broader view of that, Wisconsin being one of them. Over time, the concept of child support evolved more into a family-oriented family support program. So now, in child support programs nationwide, generally, most, if not all, of the dollars received in support flow directly to the family rather than to the state. And because of that course of evolution, or at least in part because of it, some of the states that initially adopted Medicaid birth cost recovery ultimately discontinued the practice along the way. They kind of looked at birth cost recovery as sort of a relic of that welfare recovery concept, where the money flows again directly to the state and doesn't flow to the benefit of the mother and child.
Right, so that's where a lot of the confusion comes in of people. I mean, the distinction we've made so clearly is birth cost recovery is not child support. You're in no way taking money from maybe an absent parent and giving it to a child. You're instead taking it directly opposite out of the household and giving it to the state. So this old-fashioned, like you said, a relic of the old definitions of child support is kind of what Wisconsin's clinging to here.
And it's really kind of incongruous with Wisconsin's child support policy, because Wisconsin is one of a handful of states where every dollar collected, barring some annual processing fees, flows through the state to the mother and child. But at the same time, we're hanging on to this program that does exactly the opposite, takes the money and gives it directly to the state.
Yeah, gives it to the state, and the county gets to keep their percentage.
That's right. And along the way, by way of example of some states that have discontinued the policy, Washington State stopped doing it in 1990. North Dakota used to do it, quit it in 1992. Arkansas quit it in 1998. And as of 2010, there were only 9 states still pursuing this policy. Since then, one of those states, our neighbor Minnesota, quit doing it just a few years back. They determined it wasn't serving the best interests of the mother and the child. And one other state, Idaho, stopped doing it, although they had a very different reason for doing so.
Theirs was that was a constitutional challenge.
It was indeed, and the state courts of Idaho concluded that their birth cost recovery policy violated the Equal Protection Clause of the 14th Amendment because it could only ever assign a judgment to a man, and it would never adversely impact a woman. So it was on gender grounds they decided it was unconstitutional.
Interesting, because I mean that when you think of the disparity, we talked a little bit before about the race disparity. This is impacting minority families more than white Caucasian families, mostly just because of who is unmarried at birth and when the mother is enrolled in Medicaid. Idaho made the argument you would only ever go after a man, never a female. But there's also the treating married versus unmarried families differently, which is where I went first with the disparity of, you're not doing this collection action for married families, at least the way it plays out. It's almost always going to be unmarried where you're looking for a support obligation. So it seems like there could be layers of that unconstitutionality if the wording was just right in that.
I think that's right. The policy itself, as I mentioned, does allow for some circumstances where a married father could potentially be assigned a birth cost judgment. But in practice, as I say, I've never seen it, and I doubt that it happens very frequently. And as mentioned, we can make some pretty clear inferences about its impact on different racial populations.
Yeah. Well, that's a lot to digest. Thank you, Rich. For that perspective, we know we're going to still see some families coming through the door. Some of the examples Robin and I have been talking about are instances of cultural marriage where, the family maybe was married traditionally, but not according to state law, and that's a family that's being treated differently. And just all the other variations, no two families look the same. So some of these policies, these relics on the books, are just not making sense in 2020.
Yes, and in an age where the American family and our ideals about marriage continue to evolve, I think we really need to take a hard look at whether this is a policy that continues to be worth pursuing.
Yeah. Thanks, Rich. Thanks for your time.
You're welcome.
It was helpful to talk to Rich to learn a little bit more about the impact of the birth tax on different types of families, as well as some of the challenges that other states maybe have brought on either equity or constitutionality grounds, challenging this policy itself. I'm now joined with Bobby Peterson of ABC for Health to give us some more context on how these birth cost recovery conversations fit into maybe a broader conversation about health and equity. And welcome, Bobby.
Thank you. Glad to be here.
Bobby, we've been talking about the birth tax for a number of years, decades even. The big question is, why are we still talking about this?
Well, there's a lot of issues here to unpack. It's pretty much deep in the weeds, and I think that it takes a while to really dig in and understand the ramifications of these issues. So this is an issue that's been going on for a long time. Mike Rust up at ABC for Rural Health identified this back in the 90s, and he would call me to discuss these cases, and it was so wrapped up in child support that we had to really tease out the birth cost recovery. But over time, research, analyzing the process, we actually made some inroads in getting the rules adjusted. Through the late 90s and early 2000s, we actually improved the process, but it really was something that had a pretty strong negative impact on low-income families, impact on birth outcomes. We felt it had an impact on infant mortality because prenatal stress is such an issue that you guys talked about earlier.
Or even the health department in Milwaukee, in their infant mortality review, made recommendations of eliminating the policy for the infant mortality outcome potential.
Yeah, and I think that it's just connecting the dots a little bit. If we can reduce prenatal stress, this is one area where we can reduce stress. It's not going to eliminate all of them, but we had a lot of support over time, too. We talked to Vicki Turetsky, who was the former child support commissioner during the Obama administration.
Sure. Yep.
And she said this is an obsolete and counterproductive policy, and it just results in uncollectible child support debts. It's just piling on to fathers that and families that make it more difficult to pay child support. This is something that's added on that counties were, in a collection process that they were, feathering their own nest a little bit.
It's like you said, infant mortality, birth outcomes, the health of a mother. These are bigger conversations than just the birth cost recovery piece. But like you said, this is one piece, but it's one we can do something about.
Yeah, we know there's a tremendous amount of stressors that low-income families in poverty in the central city and rural areas face. But here's something that we can identify, and we can take this off the pile a little bit to try and reduce some of that stress.
If you were to talk to a public health nurse or a hospital social worker, even a caregiver relative of an individual, when they are encountering a pregnant woman whose partner soon may be finding that notice that comes in the mail for a collection action, how does that conversation go? What should they be looking for when they meet that pregnant woman or that collection action is about to happen?
Well, some of it, we know that there are some counties like Dane that have eliminated the policy, so that's great. And so it depends on where you live. But it's also then trying to understand what the process is. Are they living together? Because there's still a rule that says if you're living together as an intact family, child support would be inappropriate. So
Sure.
that's something that they should know and make sure that the child support office is aware of that too. One thing that I can say in these situations is that most of the fathers and the families that are working together on these issues don't have legal representation. So it's really not a fair fight. They are against the child support attorneys, and they're facing a process that's intimidating and out to get money from them. And it irritates me to no end to see these families have to go in without any type of civil legal representation for the most part. Very few of them have any representation.
Oh, we've heard from families where, the mother and the father, both have to take off work.
Absolutely.
They bring the baby with them. They go in front of the court commissioner or a judge. They don't know to say, excuse me, based on administrative rule, we're an intact family,
Yeah.
and therefore there's a presumption that
Never
you
heard of
shouldn't
that. Right.
assess child support. It's an uphill climb, and most people get that notice. Anecdotally, people get that notice. They see it's for what looks like a child support
Sure.
hearing, and they say, well, there shouldn't be child support, and they don't go.
Right. Well, it's a default judgment because they can't take off work, even though they might lose their job. But there's a lot of other things I would tell a public health nurse. I would talk about the good cause process. We know that that's an opportunity for a woman to identify good cause, not to identify the father. And there are reasons because of either emotional or physical abuse that you can identify as a part of a good cause application that can be
Sure.
assessed, so you don't have to identify the father.
And
But-
still keep your badge of
Right.
Care Plus and not get sanctioned
Sure.
60 days
I mean,
postpartum.
Yeah, otherwise you lose at 60 days postpartum. And but it's deep in the weeds.
Yeah,
And
people
when we
don't-
looked at this,
don't
it
know about
was about 20,000 births in Wisconsin. There are about 44 good cause applications approved, and that's for beyond just child support. Includes W-2 and other things. So
That's total.
Yeah. It's not used very often.
Yeah, that's a signal that people don't know about the exceptions to the rule. They might not
Right.
know about the rule, but they certainly don't know about the exceptions to the rule. We've seen, like you said, success in Dane County.
Mm-hmm.
But that's effective January 1st looking forward. It's possible people that live in Dane County could still have judgments from 2019,
Well, yeah,
from
Dane
10 years
County
ago.
and the rest of the state. I mean, there's people that are facing birth cost recovery that were judgments entered 10 years ago. They're still
Yeah.
paying them off. So it's causing harm to many families. It's still going to be causing harm to families in Dane County because of these old judgments, and they're continuing to pay them off slowly. So it's a situation where hopefully looking forward, we can eliminate the process from continuing in Dane County and other parts of the state. We hope that we can help unwind and remove some of these old judgments by working with families, by working with child support offices to move to vacate these judgments. I think that we have hope that with working with the governor's office, working with the Department of Health Service, and others, that we can eliminate this policy like it's been eliminated in most, or never even started
Yeah,
in most
in the
states
rest of the
across
country.
It's
Right.
a bad policy. It needs to go.
Right, in the best interest of children, in the best interest of families, and then the economic impact of actually having pregnant women connected to benefits, having good health outcomes, and having a good start at life for that new baby.
Yep.
It's a lot to unpack.
Yeah.
Thank you, Bobby.
You're
Thank you
welcome.
for joining us.